I walked into John Wells production studio, and who other but Noah Wyle was around the corner. And I got to sit at the head of the table in the writer's room and got to tell more stories. My name is Dr. Sylvia Owusu-Ansah. I'm a pediatrician, a pediatric emergency medicine physician, and an EMS physician. I am an associate professor of both pediatrics and emergency medicine. And then I'm also the EMS medical director at UPMC Children's Hospital, Pittsburgh. My good friend, Dr. Beth Hoffman, here at the University of Pittsburgh School of Public Health. She is connected with a nonprofit called Hollywood Health and Society, and their main purpose is to provide evidence-based health content to all television shows. The Pitt had reached out to them as a resource, and they were specifically looking for somebody in the city of Pittsburgh who has a focus on emergency medicine and healthcare disparities. And Beth was like, I know just the person. I was picked. At the time, I didn't fathom how big it would be, in the sense that I was told that there were the executive producers and writers of ER. I didn't watch a lot of TV growing up, and so I wasn't a big ER fan, in the sense that I didn't watch a lot of TV. And so I was like, okay, sure, I will talk to these executive producers, writers. So we had a Zoom call. So I was in the writer's room via video conference, and we talked for 2 hours, and they just asked the question of, specifically to Pittsburgh, what are some healthcare disparity stories that you would like to tell? What have been some of your experiences? They asked particularly about various marginalized communities, immigrant communities, maybe some racial disparities. And so I brought up things like sickle cell disease and pain management. They also asked the question, what has not been shown on medical dramas yet that you think needs to be shown or needs to be talked about. And so I talked about the uptake of children getting THC gummies, or otherwise known as marijuana gummies, and getting really sick from that. Got to talk about a lot of different storylines, the immigrant populations here in Pittsburgh. With a really good, I thought, fruitful conversation. And at that time, they were not approved for a pilot yet. They were about to be approved. And then I heard later from Hollywood Health and Society that they were approved. And I had an opportunity to go to LA for my EMS job in May of 2024. And I connected with Hollywood Health and Society because I just wanted to thank them for the opportunity to be able to be a part of this wherever the show was going to go. We didn't know at the time. And they surprised me by saying, guess what? It's your lucky day. The writers are in the writer's room. We're going to take you over. I walked into John Wells production studio, and who other but Noah Wyle was around the corner. And I got to sit at the head of the table in the writer's room and got to tell more stories. And that's when I told them about the essence of Freedom House, in which Freedom House is the first ever EMS paramedics as we know them. And they happen to be 25 Black men, later women, in historically Black neighborhood of the Hill District in Pittsburgh. It was an amazing experience.